Welcome to my channel. This is Nurse Vivian, Nurse V for fun. Today we are going to be talking about ovulation, menstruation, and safe period. How to calculate safe period. I'm going to try to explain it in a simple term. I'll make sure I'm not using medical jargons. I'll explain it in a way that everyone will understand. Okay, what is ovulation? Ovulation is the release of a mature egg from the ovaries, and it passes through the fallopian tube to the ampulla. The ampulla is also part of the fallopian tube, but is the widest part of the fallopian tube where fertilization occurs, and all the eggs needed for reproduction in a female are produced at 20 weeks in vitro. It means the eggs, the ovum that a woman needs, they have already been produced when you are still in your mother's womb. There are about 4 to 5 million. But at birth, the system reabsorbs some of this egg it will now fall from 4 to 5,000 to 1,000. As time goes on, the body keeps on reabsorbing some of the eggs back to the system. When it gets to puberty period, you will just be left with about 400 to 500 eggs in your ovaries. And these 400 to 500 eggs will carry you all through. Now we are going to be talking on the signs and symptoms of ovulation. How will you know you are ovulating? First of all, the released ovum stays just 12 to 24 hours. And if there is no fertilization after this, the eggs disappear. You won't even notice it because it's so small. It's the size of a pinhole. So let's talk about the signs and symptoms of ovulation. 1, you will notice increased cervical mucus, which will be slimy or slippery. When you pick it up, when you go to urinate in the morning, just get a tissue, wipe yourself, you pick it up, you will notice it is slimy or slippery. That is ovulation sign. Then secondly, there will be slightly increase in your body temperature. That is 2. Thirdly, breast tenderness. Whereby you feel some pains around your breast, in your breast, because that is one of the signs and symptoms of ovulation. Then fourthly, there will be pelvic cramping. It will not be that much, but at least slight pelvic cramping. Then there will be backache. Then lastly, there will be vulvar swelling. Talking about menstruation, a lot of people will tell you menstruation is bad blood. Who does that? They will tell you when you are menstruating, you are unclean because you are bringing out bad blood. No, darling, you're not bringing out any bad blood. It is your own fresh blood that is coming out. During this ovulation, the ovaries produce two female hormones called estrogen and progesterone, which helps to build up the lining of the uterus in readiness for the implantation and the nourishment of the fertilized ovum. But when there is no fertilization, this building of this ovum, when there is no fertilization, these hormones drop. And when the hormones drop, the lining of the, when this fertilization did not occur, the hormones stop, the progesterone and estrogen stop, and this build up lining of the uterus start shading and bleeding occurs. That is menstruation. So you are not bringing out any bad blood. You are menstruating because there is no fertilization. So every readiness for the baby will start coming out. The lining, the soft lining of the uterus starts shading. Please like, share, subscribe. Please encourage me to do more videos by subscribing, please. Does Vivian loves you?